Hello, everybody. I'm Dr.
Hi.
Janae Brown. This is Dr. Nicole Palermo. We are two physical
Hello.
therapists at Physical Therapy San Pedro. We are coming to you from home during this time that we are all in quarantine to talk to you guys about telehealth. If you don't know what telehealth is, we'd like you to stay on this discussion, learn a little bit about it. We're going to tell you the pros, the cons, what we love, what we don't love, how it can benefit you during this time where you might be at home and be injured and not sure what to do. Dr. P and I, this is our first time that we're doing this, and in terms of telehealth, and we are really enjoying it, and our patients are really benefiting. So we'd love for you to stay on and listen in and hear what we got to say. Anything?
Yeah, great intro, Dr. Brown. I just want to say hi to everybody. We just want to thank you for, staying at home during these different times that we're having. I know it's rough on everybody, and we're all in these periods of transition where, gyms are closed, you're not knowing how to work out or what to do, and a lot of people are staying at home with kids and keeping their kids at home. So we just want to thank you so much for obeying the orders and just trying to be safe and as healthy as possible. So like she said, stay on this call or stay on this chat and just hear what we have to say about telehealth, because there's some really good things. And so if you're curious at all, just, keep listening, because we're going to give you all of the juicy tidbits.
That's right. That's right. So Dr. B, why don't we start with, why don't we start with talking about a little bit about what telehealth is. I'm going to have you sort of go in and answer that, but so I'll give you guys a little bit of background about why we decided to go and, do telehealth. We were sort of on the forefront of a lot of other clinics when we were told that we haven't actually been told to close. So we're an essential business. Most physical therapy clinics many are staying open right now. And just sort of choosing which patients they feel are a necessity to see. So we don't have to close, but we sort of took it upon ourselves to say, what can we do in this time safety-wise for our patients, for anybody at risk? So we decided to pull it together really quickly and get us on a telehealth platform and offer that to our patients right away. And we wanted to just be able to meet everybody where they're at. So we are still seeing patients in clinic on an as-need basis. There are some things that we feel we can't do, and giving that option. But we took it, what's the words? We charged ahead, shall we say, and we decided to do telehealth right away, just for the safety of our clinic, so and our patients. So, but a lot of people don't know what telehealth is, and so Dr. P, tell us, what is telehealth? What is it for our listeners and for people watching?
Yeah. So telehealth, if most of you don't know, has been around for quite a while. It's been used by physicians and nurses and physical therapists for patients who are unable to come to the hospital, who live in remote areas, or, even like insurances have been starting to offer like teledoc services where you can just call a nurse and ask if, a question before having to go into the actual hospital. So telehealth has been utilized for quite some time. I think this short period of time that we're in has forced us to just really jump in and do telehealth. So what it is the primary care or the physical therapist is bringing the services to you. So we're videoing you. We have a HIPAA secured platform through Gmail that we're working with, and Zoom as well. But we are going in, calling people, seeing them in their homes, and then just guiding them through what they would be guided through in the clinic. So we just try to be creative with it and really just help extend their care at home.
Yeah.
So that's what, and then we are, there's a lot of different phases of physical therapy. So there's therapists that work in skilled nursing facilities and hospitals. We work in a sports physical therapy clinic. So we have more, I would say, higher level patients. So we are doing higher level activities with our patients in the home. So it's been really fun to extend that care out to our patients.
Yeah. Some people might think, telehealth, how can you see a patient, how can you treat a patient over a video conference? Like, how can you really help patient that way. And for us, we're movement specialists. So we see movement and we see it incorrectly and we correct it, and we do that with our words. So yeah, sometimes it's nice to be able to like give that tactile cue or whatever and touch a patient, but we can see with our eyes. We see what someone's doing wrong. We correct with our words. We use our brains. And so for us, and especially for us, because we are treating more of the sort of the athlete, most of our patients can move and move well, and our goal is to get back to moving, whether it's sport or hobby or recreation or work, a really physical work activity. So for us, our goal is always, the end game is we're moving. We're moving. So we're trying to get patients moving right away. So it's one, I feel like for us, when one of our patients have done it for the first time, they realize, wow, this isn't like not much different from being in clinic with you. It's kind of the same.
Yeah.
We're being creative with the equipment we have at home.
And I think the type of practice that we've adopted at Physical Therapy San Pedro is, I mean, we don't rely on our manual skills a ton. You know, we probably, I mean, I would say less than 50% for sure of our treatment session is manual, but it's all movement based. It's getting the patient back to being comfortable with moving well. And all that can be done via video as well. So it's been really nice, and I think an easier transition for us than other clinics may potentially be having.
Yeah, for sure. So let's talk about some of the things that you like, we like and we don't like. But before we do that, I'll go into a little bit of my experience with telehealth, because, you know, telehealth is sort of been, before this happened, telehealth has been sort of this big discussion within healthcare for probably about a year or two. And I know that places have been moving to do it. I think physicians moved to it first. A lot of insurance companies are to offer it. I think cost-wise, it helps reduce costs if you can call in to your insurance company and get a doctor on the phone and not have to go in for a visit. So, but recently I went to our annual Physical Therapy Association conference in Denver, and telehealth was a huge topic. And then last year, towards the end of the year, I went to our CPTA conference, California Physical Therapy Association conference, and telehealth was a big topic. And there was some resistance with it initially, because people are like, physical therapists in particular, like, we don't want this to make our profession less direct. We're such a people profession. We like to be with people. We want to not necessarily have to do soft tissue work or, you know, joint mobs or touch them like that, but we like to touch our patients. We like to be around them. We like to give them like high fives, all that stuff. So we were afraid that maybe this was going to take away from the direct care that we've had. But at the time when they started talking about telehealth, it was really, look, there's people in the world who are in rural places that don't have access to physical therapy, and you can step in that gap and be somebody for someone who is sort of not near you. But some of us were on the forefront of that and got on those platforms and wanted to do that. And others of us were like, okay, that's for you, but that's not for me. You know, I'm going to continue my clinic the way it is. I don't really want to do that. But what's happened now is it's forced pretty much every healthcare professional to either decide to go telehealth and figure it out right now and have a business and help your patients and keep moving, or close your business. If you're not someone who is willing to
adapt
and adapt, right, modify, then you're not doing it, you know. So that's sort of my sort of experience. Dr. P, what it's been your like, and for me, I wasn't resistant either way. It was just like, no, not for me, not right now. What's been your what was your experience?
Yeah, I wasn't really scared about transitioning into telehealth or nervous, because I on Instagram or on Facebook, you know, I follow like certain physical therapy blogs, and they're just kind of, everyone's a little hesitant, like, oh, but we can't use our manual skills, or, oh, you know, is this right for us? And I really wasn't scared to transition into telehealth. I think that because we do use our verbal skills so well, that it was an easier transition. But I think that I heard you talk a lot about telehealth in the beginning when you came back from your conferences for concussion rehab, because you are a concussion specialist and one of the few in the Southern California areas. And so I feel like that is a big avenue for you for telehealth, that you can reach out and extend yourself to people that don't have the care local to them. So I think it's a really big avenue, and I'm glad we're getting to, for the most part, practice right now and get really, really good at it.
For sure. And I think for me in particular, I get through our Instagram and mostly through Instagram, I get contacted regularly about, gosh, I wish you guys were our physical therapist. I wish you were my physical therapist. You are so awesome. You guys do such great work or whatever. And I'm like, oh, I'm sorry. Like, maybe I'll help you find somebody in your area. And now I feel like we've opened that platform to be like, okay, well, we do telehealth. So if you really need to want to book a telehealth consultation, we're completely set up with the platform. We're moving our forms to the website. We're getting completely like on a complete sort of digital platform to be able to do everything that way. So I think it's going to help us in ways that we didn't really expect. Dr. P and I have modified our treatment a lot, and everything's been online, and I'm sort of liking it, to be honest. So we'll see how it goes in the future, but definitely opened up a window for us for sure. Talk to me about what some of the things that you like, Dr. P, about telehealth. What do you like so far? What have you liked and enjoyed?
So I've enjoyed the fact that we kind of get another little eye into people's homes, not in a creepy way, but we get to see like how they're set up, see their backyards, and kids have basketball courts and trampolines and soccer goals. So it's nice to see that we can help the patient feel like they can utilize the dumbbells that have been sitting in their garage for a long time, or get that jump rope back out, and then start working out at home. So it's just been really cool to be creative with patients and just not help them feel like they're reliant on a gym or reliant on others to come in and help them be physical and stay active. So it's been really fun just to be creative and get into their world.
Yeah.
With PT.
Yeah, I think so too. I'll talk about the cons here. So I feel like one of the cons is that we don't have all the equipment that we usually use. We sort of take for granted that we have all this great equipment. And I remember when I opened my clinic, I had very minimal things. And a lot of people go and do home health therapy, and they have very minimal things and you figure it out. But it does tap in that space where like, okay, I'm a little spoiled right now. I have every piece I have a kettlebell, I have a dumbbell. They're the same exact like weight, but I like to move it this way versus that way. So I guess the equipment part of it, because we enjoy moving and using different tools and moving things different ways, and challenging patients in that way. Any other cons that you can think about that?
We touched a little bit about the power of touch. We're just not there to give a little tactile cue, like squeeze your shoulder blades and like put your hands on their back. But, if you set them up for success verbally, then everything seems to be just fine. And if you communicate the purpose of it, everything is just fine.
Yeah. I guess the point is that it works, right? Telehealth works. And we've been able to really help people in ways that we've done now a couple evaluations now. We've actually got new patients through this project. So we've done a couple of evaluations, and those were all of our current patients, we know them, so we knew it'd be a little more comfortable. But new patients, you don't know them, you can't you feel like you can't share your energy directly with them. But we've had really great and positive experiences from our new patients, like I was talking about a new patient that I had, shoulder pain patient, was going to another therapy clinic and, saw successes with us right within a week, just was pain-free, able to sleep through the night. Huge. And just, I didn't touch them at all, so.
Yeah, that's amazing.
We don't know that, but just to see it like happen with someone we haven't had, it's been a really cool thing for sure. So
yeah, definitely.
We're going to wrap. Dr. P, tell us where people can find us. Instagram, Facebook, all that stuff. What people should know.
Yeah. So read our blog. We just wrote a blog about telehealth. We just covered some of the points. Follow us on Instagram, on Facebook, on YouTube. And if you're injured, contact us. Contact us on Instagram. Send us an email. If you want to set up for a consultation, we'd love to set that up with you and have you be part of our team, because we're having, like Dr. Brown said, great success.
That's right. All right. Bye-bye, everybody. Have a great
Bye.
day.
It was nice
Thank you
talking to
for
you.
watching. Bye.
Take care. Bye.